What E. coli types cause UTIs, and why are some more virulent? Imagine tiny bacteria that can cause uncomfortable urinary tract infections. The main culprit is a special type of Escherichia coli called uropathogenic E. coli, or UPEC. These bacteria are different from the harmless strains living in our intestines because they have unique tools that help them infect the urinary system. Most UPEC bacteria come from our gut but have evolved to stick around and invade the urinary tract, which includes the urethra, bladder, and sometimes the kidneys. UPEC is a subset of a broader group called extraintestinal pathogenic E. coli, which means they can cause infections outside the gut. Not all E. coli are harmful, but UPEC strains are equipped with specific features that make them more likely to cause urinary infections. Their ability to cause trouble depends on several factors. One key factor is their hair-like structures called fimbriae or pili. These allow the bacteria to latch onto the lining of the urinary tract firmly. This attachment is vital because urine flow naturally helps flush out bacteria, but UPEC can cling tightly enough to resist being washed away. Once attached, some UPEC strains produce toxins that damage the tissue lining the bladder, helping the bacteria invade deeper layers and escape immune defenses. Another important trait is their ability to gather iron from the host. Iron is essential for bacterial growth, but the urinary tract is a low-iron environment. UPEC bacteria have special systems to scavenge iron efficiently, giving them a survival advantage. They also form protective capsules and biofilms, which are slimy layers that shield them from immune cells and antibiotics, making infections more persistent and harder to treat. Genetic adaptations also play a role. Some UPEC strains carry genes that help them resist antibiotics and survive in the challenging environment of the urinary tract. Interestingly, research shows that some of these bacteria can come from contaminated food, especially meat from animals that carry similar strains. These zoonotic strains can infect humans and cause UTIs, especially in people with weaker immune systems. Understanding these virulence factors is important because they explain why some E. coli strains cause more severe or recurrent infections. Strains with stronger adhesion, toxin production, and resistance traits are more likely to cause persistent bladder infections or even spread to the kidneys, leading to more serious conditions. Preventing UTIs involves good hygiene, proper food handling, and seeking prompt treatment when symptoms appear. In summary, uropathogenic E. coli are the main bacteria behind urinary tract infections because they have specialized tools that help them stick, invade, and survive in the urinary system. Some strains are more dangerous because of their ability to produce toxins, resist immune responses, and adapt genetically to the environment. Knowing these differences helps us understand why some infections are tougher to clear and highlights the importance of prevention and early treatment. Always remember to consult healthcare professionals for personalized advice and treatment options.